Hello my dear friends, hope you're doing well. Today we're going to discuss about a new topic which is ABG. Here I would like to share a tip that I'm following to find out whether it is acidosis or alkalosis. Let's move on to the normal values. pH is 7.35 to 7.45. PaCO2 is 35 to 45 and HCO3 is 22 to 28. Normally PCO2 represent the respiratory and HCO3 will represent the metabolic. If pH is less than 7.35 is acidosis, PaCO2 is greater than 45 is acidosis, HCO3 less than 22 is acidosis, pH is greater than 7.45 is alkalosis, PaCO2 lesser than 35 is alkalosis, HCO3 greater than 28 is alkalosis. Then partially compensated, which means if the pH is not within or close to the normal ranges is called partial compensation. Then fully compensation, which means if the pH is back within the normal ranges, then it's called fully compensated. Let's have a look on some examples. Here pH is 7.30, PaCO2 is 50 and HCO3 is 26. Here pH is lesser than 7.35, so which will goes under acidosis, and PaCO2 is greater than 45, so it will goes under acidosis and it will represent the respiratory. Meanwhile, HCO3 is in the normal range. So it is called respiratory acidosis. Again, pH is 7.30, so it is acidosis. PaCO2 greater than 45, so it is acidosis. HCO3 greater than 28, so it is alkalosis. Now pH is acidosis, PaCO2 and the acidosis and represent the respiratory, and HCO3 greater than 28, so it goes under alkalosis. So here pH and PaCO2 is partially compensating the HCO3, so respiratory acidosis partially compensated. Then pH is 7.34, PaCO2 is 50, HCO3 is 30. Here pH is lies in the normal range, but it is slightly near to the acidosis, so we can consider this as a acidosis. PaCO2 is greater than 45, goes under acidosis and which will represent the respiratory. HCO3 is greater than 28, goes under alkalosis. So here it's called respiratory acidosis fully compensated. Then pH is 50, PaCO2 is 30 and HCO3 is 24. So pH is greater than 7.45, so it goes under alkalosis, and PaCO2 lesser than 35, so it goes under alkalosis and represent respiratory. HCO3 in the normal range. so it's called respiratory alkalosis. Again, pH is 7.5 greater than 7.45, and PaCO2 is lesser than 35, and HCO3 is lesser than 22. So pH will goes under the acidosis. PaCO2 represent the respiratory, goes under the alkalosis, and HCO3 will goes under acidosis. This is lesser than 22, so which is called respiratory alkalosis, partially compensated to HCO3. Then here pH is in the 7.44, and PaCO2 is 30, and HCO3 is 20. Here pH is in the normal range, but it is slightly near to the alkalosis, so we can consider this as a alkalosis. And PaCO2 is 30, goes under alkalosis. HCO3 is 20, lesser than 22, so it's called respiratory alkalosis, fully compensated. Here pH is 30, acidosis. PaCO2 is 40, lies in the normal range, and HCO3 lesser than 22, so it is goes under acidosis, and HCO3 will represent the metabolic. pH acidosis, PaCO2 normal, and HCO3 acidosis represent the metabolic, so it is called metabolic acidosis. Again, pH is 30, acidosis. PaCO2 is 30, lesser than 35, so it is goes under alkalosis, and HCO3 is 20, lesser than 22, it goes under acidosis. So pH is acidosis, PaCO2 is alkalosis, and HCO3 is in the acidosis. So here pH and HCO3 partially compensating the PaCO2, which means metabolic acidosis, partially compensated. Here pH is 7.34, and PaCO2 is 30, and HCO3 in the 20. So here pH is in the normal range, that is slightly nearer to the acidosis, so we can consider this as acidosis. And PaCO2 into the alkalosis, and HCO3 under 22 goes under acidosis, so it is called metabolic acidosis, fully compensated. Now here pH is 7.50, greater than 7.45, so it is alkalosis. PaCO2 is 40, lies within the normal range. HCO3 is 30, greater than 28, so it is alkalosis. pH in the alkalosis, PaCO2 the normal range, HCO3 represent the metabolic, and it's in a alkalosis, so it is called metabolic alkalosis. Now pH is 50, again alkalosis. PaCO2 is 50, greater than 45, so it will goes under acidosis, HCO3 is 30, greater than 28. So it goes under acidosis. pH is in the alkalosis. PaCO2 acidosis. HCO3 goes under alkalosis. So it is called metabolic alkalosis, partially compensated. Now pH is 7.44, PaCO2 is 50, HCO3 is 30. Here pH is in the normal range, but is slightly nearer to the alkalosis, so we can consider this as alkalosis. And PaCO2 is on the acidosis stage and HCO3 in the alkalosis stage. So here is a fully compensated, which means metabolic alkalosis fully compensated. Thank you for watching. Please don't forget to subscribe.